cannot believe how this show has grown. I should expect it because we've got two of the top eye surgeons in Tennessee who are our experts. And I want to welcome Dr. Gaduru. We call him Dr. G. Good morning, Dr. G.
Good morning. Good morning. Thanks for having me.
Hey,
It's
I
always a
understand.
fun time coming on the show.
Hey, I got to tell you, people love the way you educate people. Everybody's got their own way, but
Yeah,
sometimes, doctors kind of talk over our heads. People love the way you educate them
uh,
about such a serious topic as eye surgery.
thank you. Thank you. Hey, that's why we do this, right? There's a big educational gap, and my job here is to just kind of help make it easier for patients to understand.
Absolutely. I got to tell you, we're talking today about cataracts. And I want you to tell people, first of all, tell them about Wang Vision Institute.
Yeah, 100%. So Wang Vision Institute, we are kind of a premier institution in Nashville, Tennessee. We've been around for about 20 years. We are experts in cataract surgery and what we call refractive surgery. So essentially, we do 8 different types of surgeries to help patients out of glasses.
Well, I got to tell you that we get letters from not just the Nashville area, but from all over Tennessee of people who've literally traveled to Wang Vision Institute to have you all do their surgery. What a compliment.
That's right. Yeah, no, thank you. Yeah, we've got patients that fly in from multiple different states, and we've even had patients come outside of the country.
I can believe that. I can believe that.
Yes.
Well, I got to tell you, you're going to really get upset with me. I'm here in Florida. I wish I was in the Tennessee area. And I went because I was getting those, seeing stars at night. Uh,
Oh yeah.
and I said, I better go see a doctor about it. And I was told, you have cataracts.
Mhm.
And I didn't take care of it right away. And first of all, I don't want people to be like me. My problem is I have so many shows during the week and no one does cataract surgery usually on the weekends. And I've got to do something about that. But what happens? First of all, explain what cataracts is. And second of all, we got to educate people what happens if you don't take care of it.
Yeah, good, great questions, and I'll kind of break down each one here. So the first question, what is a cataract? So just like a camera has a lens, our eyeballs have a lens inside of the eye as well. When we're young and the lens is completely clear, and also it can do what's called accommodate. So that's why we can kind of look at any distance without the need for reading glasses. What happens as we get older is that lens undergoes kind of two changes. One, it gets very stiff, happens in our 40s, 50s, and that's when we lose the ability to read without readers. Over time, that same lens will also start to become more gray, cloudy, opaque, kind of like graying of the hair. And that's what we call a cataract. So you describe the classic symptom of a cataract, and it's that starburst, glare, kind of just a degradation of your overall vision in low lighting, dim condition, nighttime. Now, to the second point, how long should you wait? When should you have cataract surgery? So cataracts are graded on a scale of being 1 to 4, 4 being the worst. Um, One being they've just kind of started. So the ideal stage to kind of operate is kind of at the 2+ stage, meaning you're symptomatic and the cataract's causing the issue, but it's not at that 3 to 4 stage yet. Once it gets to that 3 to 4 stage, the surgery becomes a little bit harder, so it makes the chance of complications a little bit higher. So
Mm.
ideally, kind of do it around that 2+ stage, really when you're symptomatic. So once you're starting to be symptomatic, the symptoms will only get worse. So taking care of it once you're symptomatic is the best choice of action.
Well, that's that's a motivation for me, that's for sure. Because I know there's other people out there like me that keep putting it off. Um, and I'm so glad we're doing a show like this on cataracts. Is it just normal part of aging, or do you ever see like younger people having cataract problems?
Um, yeah, so the majority of cataracts are kind of, however, there are certain conditions that can accelerate it. So people that are diabetic, people with a history of trauma, people that are taking chronic steroids, all of these can accelerate the growth of cataracts. Um, and then some people just develop cataracts younger than others. Really nothing wrong in their body or something, but just physiologically, some people develop it sooner, especially people that are more nearsighted. Now, there is also a subset of categories called congenital cataracts. So, meaning some kids are born with cataracts, and in those cases, they get cataract surgery when they're very young.
What so do you see young people also with cataract problems?
We do, yeah. So, in that congenital group of cataracts, people that are kind of born with these cataracts, some of them
Uh,
get operated when they're young, but some of them, the cataract is a little gray, but not fully gray. So, they kind of just watch it. And then when they're in their 20s or 30s, now they've become really affected by it. So, we've done cataract surgery on a bunch of 20-year-olds, 30-year-olds. Um, so it can affect young people as well, but typically again it's kind of an aging phenomenon.
so I know you talked on this, but someone who's listening to the show, watching the show now, just talk about all the common symptoms that people might notice when it's first developing.
Yeah, yeah. So kind of the classic symptom is a decrease in the quality of your night vision. So
Mm.
patients are going to start to notice an increase around the headlights, kind of more starbursts, or they might see some extra glare or see more halos. So they'll kind of notice this at nighttime whenever it's kind of foggy, dim conditions like rainy conditions. All of these make those symptoms a lot worse. Other symptoms you'll kind of notice is, you'll keep going to the eye doctor, changing your glasses, but nothing seems to be working. Because what eyeglasses do is can help correct the vision up front, but you're still looking through a cloudy lens inside the eye, so they only help to an extent. Some people notice an overall just graying, dimming of their vision. So these are all signs and symptoms of cataracts.
Dr. G, we've had two texts come in since your show started. They're not about cataracts, but people who are seeing these advertisements for glasses that work both for nearsightedness and farsightedness, and that they also turn into sunglasses. Do you know anything about those? Are those commercials for real?
Yeah, so this is excuse me. So this is actually not something that's new, but that's something that's been iterated. So previously, they did used to have something like this, where patients can turn a little dial to increase how much reading they kind of wanted, and they don't work too great. And now this newest iteration that people are talking about, it's supposed to do it a little bit more seamlessly, where it's supposed to do it kind of on its own. But the feedback that we've gotten and the studies that we've kind of seen, again, they're not a great solution. So it really just
Mm,
depends on what you're looking for and what's causing that issue. So it may work for one patient, but it may not work for everybody.
gotcha. Okay. Let me get also go to lifestyle factors. What about when we talk about cataracts? What about sun exposure or smoking? We know diabetes
Yes.
increases risk, but what about the
Yes.
sun exposure and smoking?
Yeah, 100%. I mean, you nailed it. Both of those also can increase the growth rate. Smoking can increase how fast they accelerate. And same thing with increased sun exposure. So whenever you're outside, we recommend whenever you're outside, it's always nice to wear sunglasses. It can reduce that risk. It can reduce the risk of what's called pterygiums, which is little growths on the white part of the eye. It can also help protect the retina.
So, how do you, when they come to your office, how do you diagnose cataracts?
Good question. So, there's kind of two approaches to it. One is a symptom questionnaire, and then two is the actual objective testing. So, the objective testing is we can actually take a look in the eye. So when you come to the eye doctor, that cataract sits behind the pupil or the colored part of the eye. So what we'll do is actually dilate the pupil to access that area and look at it. And that's when we look at it, we can tell how gray it is on that scale. And then two, we also do what's called a symptom questionnaire. So kind of all the symptoms that we just talked about, we ask the patients, hey, are you having these issues? Have they becoming worse? So that tells us not only do we see it, but patients are also symptomatic. And then lastly, we also have what's essentially called glare testing. So we check your vision in those night vision simulated areas. So we can simulate what happens when it's nighttime and see how much your vision drops. And so that tells us how bad the cataract is.
I'm sure there's people that maybe starting to find out they've got cataract problems. Can those be treated with glasses or medication, or is surgery the only option?
Yeah, no, I mean, so as cataracts grow, it's going to continue to change your eyeglasses prescription. So you can continue to keep updating your eyeglasses prescription, but it will only help to an extent because again, you're putting something in front of the eye, but you're still looking through a cloudy lens inside of the eye. So the glasses will only help to an extent. Um, to this date, there's no medication, there's no supplement, there's nothing that you could do or take to get rid of that cataract. So right now, the only solution is surgery.
Mm. And don't wait like some of us do, that's for sure.
Yeah, I mean, cataracts slowly grow, but yeah, you definitely don't want to wait too long. I mean, to put it in reference, cataracts are the leading cause of blindness worldwide.
Wow.
So that's because a lot of people don't have access to ophthalmologists. They just let that cataract get really, really big until they really can't see at all. And that's when they're getting that surgery. But in the US, you know, cataracts is not the leading cause of blindness just because our screening here is better. People are more proactive about it.
Is do you have to, the surgery, do you have to miss work at all?
Most of our patients are functional enough to go back to work the next day. So we do one eye at a time. It's considered what's twilight anesthesia, meaning that we've got an anesthesiologist there, helps calms the nerves, but you're still awake. Procedure itself takes about 15 minutes. So we see you back in the next day in the clinic, and most patients are functional enough to go back to work. Now, we do say for about 2 weeks, no heavy lifting, bending, or straining. And then we do each eye about a week apart. So within kind of 2 weeks, patients are back to their full daily activities, no restrictions.
Dr. G, there's so many articles, especially on the internet, and people read all. I mean, it's amazing. Sometimes I think it hurts the profession more than it helps because you get a lot of different ideas. But what misnomers are there out there about cataract surgery?
Like you said, I've heard so many.
Yes.
A big one is that supplement question you had asked me. A lot of people think, hey, doc, I saw this commercial that if I take this vitamin, I'm not going to have cataracts. So that's a big one. The other one that I've heard of, this is a really, really big one, is a lot of patients are told by their doctor that cataracts, they're not ripe enough. So they'll tell them, hey, don't go get surgery yet, just get some glasses. So I tell patients, whenever they hear that, take that kind of with a grain of salt and be a little cautious, because you've got to be careful who's advising you that. So, really, there's no concept of they have to be ripe enough. Really, you have to be symptomatic. So if you're symptomatic and you go see an eye doctor, but they tell you, oh, they're not ready, I would go see an ophthalmologist. So there's no point in suffering through the symptoms when there's something that could be done about it.
Gotcha. What about now? There's different types of lens implants available.
Yes, yes.
How do you know which one's right for you?
Good question. Good question. That's kind of what we subspecialize in here. That's the refractive part of it. So, the eye is 1 inch long, but there's over 12 subspecialists within the eye. So, it's a very kind of nuanced decision making between the provider and the patient. But broadly speaking, there are lenses that can correct your astigmatism. There are lenses that can help get rid of some reading glasses. And then there are also lenses that we can adjust even after the surgery. And then there's lenses, just like people wear a bifocal or a progressive, they're called multifocal lenses that we can implant inside of the eye so that you don't need glasses for anything. Gets rid of your reading glasses, distance glasses, and astigmatism. Um, you, who's a good candidate for them really depends on your eye anatomy. So we really, when you come in, patients get almost 6 types of different testing prior to cataract surgery. And we look at all of those tests to determine if you're a good candidate or not. And then if you're a good candidate, we kind of go over um, the case unique to you, meaning, hey, would this be a good fit for you, or would you want something else with your vision? So we kind of tailor it to what they want.
So, are there advanced options that reduce dependence on glasses after cataract surgery?
Yes, yes, yes. So those are called the multifocal implants. Here we call them the forever young lenses because it's like
Hmm.
forever young, keeping yourself young.
Yes.
Exactly. So those are kind of the most advanced kinds of lenses that we have today.
So, after you have the cataract surgery, how long does it take to start noticing a difference for like night driving?
Almost instantaneously.
Hmm.
So, uh, some people, it is still surgery. So, meaning the next day you might still be a little blurry, but you'll be functional. But within a week, patients are, it's night and day for them. I've had patients repaint their whole house after cataract surgery because they didn't appreciate the colors and things that they were looking at. So the effect is almost instantaneous. Another big one I almost hear is they're like, Doc, I didn't realize how bright the world is. And
Yes.
now they're back into reality and they're seeing color and light just like the rest of us are seeing.
I got to tell you, the one thing you said that is, I'm calling up my doctor right after the show is how many people who don't take care of cataracts that go blind. I'm calling the doc. In fact, I'm going to cut the show early. No, I'm just kidding. But no, I don't think a lot of people actually know that, Dr. G.
Yeah. No, yeah, with cataracts, I mean, the thing is because they slowly grow and our brain, we just kind of get used to the decline in vision, people have a tendency to put them off. And then the bigger they get, the bigger the decline in your vision. And then it reduces your options for some of the advanced lens options and it just increases the risk of the surgery. I mean, we do plenty of patients with advanced cataracts. I mean, it still happens, but there's a component of it's a little bit more better to be proactive sometimes.
Dr. G, I got to tell you, the day that you decide, I don't know if it was during your internship or your residency, when you decided to go into ophthalmology,
Yeah.
that was a great day for people in Tennessee.
Thank you. Thank you. Yeah, I appreciate that.
You're glad you made that decision. I know.
Yes, yes. Yeah. I mean, my background was actually in biomedical engineering. And to me, ophthalmology is just it's very quantitative, right? I can diagnose the issue, I can look at it, I can calculate it, and then I can just take care of it medically and surgically. So it kind of has everything that I really enjoy.
Tell people how they can reach Wang.
Yeah, so the easiest is our website, www.wangvisioninstitute.com. We even have a patient inquiry form right there. If you ever have any questions or if you wanted someone to reach out to you, you just fill up that form. You could always also call us at 615-321-8881.
Well,
The Wang Vision.
You're the best, Dr. G. We love you. We love Heather too, and Dr.
Yes.
Jones.
Yes.
So we'll see you next month.
Yes. Thank you so much.
Feel better too.
Coming out here. Oh, thank you. I appreciate it.
Thanks, Dr. G.
Yes. And if you ever have questions about your eyes, let me know.
We'll see you next month.
Okay.
That's Dr. G. Wang Eye Institute. We're going to go to a quick break. We'll be right back.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.